Welcome and thank you for joining our session. My name is Beth Stapleton and I'm the Director of Marketing at ZephyrTec. Also joining me is Chris Mantani, Senior Account Executive at ZephyrTec. Today we're excited to introduce Microsoft Dragon Copilot for Healthcare, presented by ZephyrTec, a certified Nuance and Microsoft partner. We'll walk you through how this AI powered clinical assistant is transforming documentation, streamlining workflows, and helping clinicians refocus on patient care. After a short introduction, Chris will then demonstrate Dragon Copilot. Let's start with the challenge. Clinicians today are overwhelmed with administrative tasks far beyond just documentation. From charting and messaging to navigating the EHR, the burden is really significant. This leads to burnout, staffing challenges, and reduced access to care. And perhaps most importantly, it pulls attention away from the patient. That's where AI creates a major opportunity, not just to speed up documentation, but to transform the entire clinical workflow. By reducing administrative work, we can return time to clinicians, improve care delivery, and enhance both patient and provider experience. Dragon Copilot is Microsoft's unified AI clinical assistant, built from proven technologies like Dragon Medical One and Ambient AI. It captures clinician and patient conversations, automatically generates structured clinical documentation, and integrates directly into existing clinical workflows. Already, more than 100,000 clinicians use it daily to support care delivery. At its core, Dragon Copilot focuses on three things: streamlining documentation, surfacing information, and automating tasks. Let's start with how Dragon Copilot streams documentation because this is really where the clinicians spend a significant portion of their day. Dragon Copilot uses ambient conversation capture to automatically listen to and document patient encounters, even in multi party and multilingual settings. That means no more manual note taking during the visit. From there, it automatically converts conversations into comprehensive, specialty specific notes tailored to the way each clinician practices. What makes this especially powerful is the level of customization. Clinicians can apply their preferred style, formatting, and templates either automatically or on demand so documentation aligns with their workflow, not the other way around. There's also a built in prompt and text library helping clinicians quickly reuse common phrases, shortcuts, and documentation patterns to save time. For more complex workflows like emergency departments, Dragon supports ED, MDM, or emergency department medical decision making note styles, capturing the clinician's reasoning and the full patient journey in a structured way. And finally, AI Note Assist helps clinicians edit, summarize, or expand notes with simple natural language commands. All of this is powered by specialty specific AI models, ensuring accuracy and relevance for each clinical context. The result is faster documentation, less manual effort, and more time focused on patient care. Next, let's take a look at how Dragon Copilot helps clinicians surface the right information right when they need it without leaving their workflow. Using natural language, clinicians can query patient notes instantly. For example, they can ask questions like, what medications were discussed? Or did the patient report any adverse reactions? And get immediate answers. Dragon also integrates with Microsoft Fabric, enabling healthcare organizations to access and analyze encounter data at scale. This turns everyday clinical interactions into actionable insights for improving care and operations. Built in analytics provide visibility into the productivity, adoption, efficiency, and even dictation quality, helping organizations continuously optimize performance. There's also coaching functionality, which gives clinicians feedback on their recordings, suggesting ways to improve documentation completeness and quality. And with Information Assist, clinicians can access a wide range of trusted medical information directly within the workflow with grounded cited responses from reputable sources. Put simply, Dragon Copilot ensures clinicians have the information they need when they need it without breaking focus or switching systems. Finally, Dragon Copilot takes things a step further by helping clinicians automate time consuming tasks with a single click. It starts by capturing orders directly from the patient conversation and preparing them for placement in the EHR, reducing manual entry and missteps. It can automatically generate after visit summaries, turn the conversation into clear, personalized instructions for the patient. Dragon also enables clinicians to summarize clinical evidence supporting each diagnosis, helping validate documentation and reinforce confidence in the note. Need a quick recap? It can summarize the entire encounter into key facts and insights, which is perfect for review before sign off. It also creates referral letters instantly, pulling directly from the transcript, which saves time while ensuring consistency and completeness. And for revenue cycle optimization, it provides coding suggestions either on demand or automatically applied, helping improve accuracy and reduce denials. The bottom line is simple. By automating these routine but critical tasks, Dragon Copilot reduces workload, improves accuracy, and gives clinicians valuable time back in their day. Dragon Copilot is designed for the entire care team, not just for physicians, from nurses to support staff to leadership. Everyone benefits from reduced administrative burden and improved access to information. The impact is measurable. Clinicians save time on every encounter, improve documentation quality, and can see more patients. Just as importantly, they experience reduced cognitive load and can engage more meaningfully with patients. The key takeaway is this: Dragon Copilot enhances existing systems rather than replacing them. It delivers meaningful efficiency gains, but success depends on how well it's implemented within current workflows. What sets Dragon Copilot apart is its combination of clinical expertise, advanced AI, and Microsoft's secure cloud platform. It delivers the accuracy, speed, and scalability healthcare organizations need, not just for today, but for the future. Now that you've heard what Dragon Copilot can do, let's take a look at it in action. I'd now like to turn over today's presentation to Chris Mantani. Chris?
Thank you, Beth. Hi, everyone. Today I'm going to go ahead and walk through a patient visit with Beth so that you can see how easily you can record a patient visit. And then I'll walk through a few AI things to show you what you can do to enhance your note. As always, if you have any questions after or you'd like to dig deeper into it with me, please feel free to contact me and I will be happy to schedule a one on one time to work with you. So I'm going to go ahead and create the patient visit here. And down here is where you will start your ambient recording. And you don't want to use this microphone button. That's used when you want to give it the AI prompts. But for here, I'm going to go ahead and start the ambient recording so that Beth and I can do our patient visit. Good afternoon, Beth. Do you mind if I record this visit?
No, that's fine.
What brings you in today?
Well, for the past week, my throat has been getting more and more sore, and I do kind of feel hot.
I see. Does it hurt when you swallow?
Yes, there's pain when I swallow.
Have you had a cough or anything like a runny nose?
No, no cough, nothing like that. I do feel a little warm and clammy, but mostly my throat is just really painful.
Have you been around anybody that's had any symptoms like yours?
Well, I did volunteer at my daughter's daycare, and some of the kids there were coughing.
Well, that doesn't surprise me. Kids can pass a lot of things on to us. Go ahead and open your mouth. I'm going to take a look.
Okay?
You do have a lot of redness, and I think I see some pustules. I'm going to go ahead and take a swab. I'm also noticing in your chart that your temperature is about 100 degrees.
Yes, I feel like it.
So I'm going to go ahead and have my assistant do a rapid stress test culture. I think you may have strep throat. Okay, the culture is back and you are positive for strep. So I'd like to prescribe you an antibiotic. Are you allergic to anything?
Yes, I'm allergic to penicillin.
All right, well, then I'm going to go ahead and set you up with a prescription for azithromycin. I'll print that order out and you can pick it up at the front desk on your way out. Do you have any questions for me?
No, not at this time.
Okay, well, thank you for coming in. And if you don't feel better after being on the antibiotic, please let me know. I hope you feel better soon. So once you're finished with your patient visit, you go ahead and stop the ambient recording. And then you can see there that it says it's generating the note and the transcript so that you'll have access to see exactly what was said in the transcript. And then the note will give you the summary of the patient visit within the different fields that are pre-assigned within Microsoft Dragon Copilot. And as I said, the transcript just allows you to go in here. So you notice when I first started, I did ask Beth if it was okay to record the visit. You do want to make sure that somehow you do receive permission from your patient to record the visit, either in the paperwork they fill out when they first come in, have them sign, or verbally receive that authorization. You can go up here and you can edit the name of the patient session to help you keep your sessions organized. So I could put Beth sore throat and then today's date so that I know that this one was done today. When I'm finished, I will save it and then it just updates the name of the actual session. I can go in and give it AI prompts to add ICD codes or add some things to different fields if I want to. So for example, I use this dictation button here to give it the prompts. So I'm going to ask it, add ICD-10 codes, each on a separate line to the end of the physical exam findings. Once I'm finished giving it the prompt, I send it so that it will go ahead and do what I asked. You could see there that it says it's generating it. I can then give it another code. I can give it multiple AI prompts at one time without stopping between them. Update the fever reading to 101 degrees. Add penicillin to the allergies field. Add to the social history field that the patient smoked for 10 years but has quit. And I can go ahead and let it just generate those. And then you can go in and you can change notes, styles of your note, rather. Sorry. So here it says patient smoked for 10 years. It added the penicillin. If I scroll down in the note, it did add the ICD-10 codes. So you can have it create additional enhancements to your note for you once you've had that patient visit. I can also ask it to apply a note style. So you can just click on this button here, or you can ask it to apply a note style. If you have one, you see there that it's generating to apply a note style because I had asked it to, I have a note style to have it bullet my allergies field. And I only had one allergy in there, but it did bullet that particular one. So if I had other ones down here, it bulleted the labs. So you can go in and give it different styles. If I go in to the styles. There's many things you can choose from to create your own note style based on what you want in there. So here's my one bulleted list for allergies. Nothing, I haven't done anything in family history. In medications, I have it as a bulleted list. So if I had some patient medications, it would do that as a bulleted list also. Okay, so you also can go in here to the settings and you can choose a primary specialty from the list here. There's many things to choose from. You can choose the secondary specialty. You can choose the role if you're a physician, nurse, administrator. So you have lots of options to choose from there. You can choose one microphone. I already mentioned that this is where you can go and choose your note style. And then if we go into the library, you can go in and you can update your vocabulary. So here I have a couple of things that when I say ZTech, or I'm sorry, when I see ZTech, it prints ZTEC. When I say CBC diff, it prints it like here. So you can go in and add things to your vocabulary. You can add little text shortcuts to your vocabulary so that you'll have things that you can do. And then the other thing that I can do is I can ask it to draft an after visit summary for me. Create an after visit summary. I can also have it create, if you look here in this, so here's my after visit summary here that I could then easily copy and paste that. There's a copy button here. I could just tell it to copy that and I could paste it over into a Word document that could be printed to give to the patient or a letterhead. You could copy and paste it over to an EHR if you wanted to. So I can do something like that. I can also, if you see here, I can have it draft a referral letter, apply some custom templates. So there's several things that you can ask it to do. Draft a referral letter to an ear, nose, and throat physician. So here's my referral letter. I could go in and just fill in the date, and it's putting the information based on what was discussed in the patient visit there in the referral letter that, again, I could copy and paste into a Word document. And I could even paste it into my HR if I wanted to have a record of it there. Again, please let me know if you have any questions or would like to discuss anything further, and I would be happy to assist you. I'm going to go ahead and turn it back over to Beth to see if there's any questions.
Okay. Well, I just want to thank everyone for taking the time to join us today, and thank you, Chris, for the demo. We will now open the floor up for questions. Okay, the first question we have is, how does Dragon Copilot reduce documentation time?
Sure. So Dragon Copilot uses ambient listening, speech recognition, and generative AI to automatically capture patient encounters and generate structured clinical notes in real time, which reduces manual typing and after hours charting, giving you back some time in your day.
Okay, let's see. The next question we have is, can I customize note styles or templates?
Yes, as you saw there, I had done a couple of custom styles for my note. So clinicians can tailor their note format to match their specialty specific templates, such as a SOAP note, a discharge summary, and then also to their personal preferences.
Okay. And just as a reminder to folks, if you do have questions, please use the questions pane within the GoToWebinar interface. Okay. Is Dragon Copilot HIPAA compliant?
Yes, Dragon Copilot is built to meet all HIPAA and enterprise healthcare compliance standards, including secure data handling and encryption.
Where is patient data stored?
Data is handled within Microsoft's secure cloud infrastructure, Azure, which with strict controls on access, retention, and processing.
Okay. Let's see. The next question we have is, does it support multilingual interactions?
Yes, it can recognize and transcribe over 50 languages, which can be helpful in a diverse patient population.
Okay. How quickly can clinicians adopt it?
Most users can begin using Dragon Copilot with minimal training, especially if you're familiar with the Dragon Medical suite of tools and have already used some of them. We do offer some training to get you started and kind of show you some of the things that were covered today to help you to personalize your Dragon Copilot for your needs.
Okay. Let's see. Can Dragon Copilot generate or assist with ICD-10 coding?
Yes, as you saw, I did create some ICD-10 codes for Beth in my encounter. So it can suggest relevant codes for you based on the clinical documentation and what was generated from the patient encounter. It will also analyze the context of the visit, the diagnoses, and the procedures discussed to help surface appropriate codes for your review. However, please keep in mind you should always kind of review your notes to make sure that everything is accurate and compliant.
Okay, it looks like the last question we have is, how does it compare to other ambient AI solutions?
So, some of the key advantages, it uses deep integration with the Microsoft ecosystem, Azure Teams, and the security stack. It's proven Dragon speech recognition foundation, making it the most accurate solution on the market. And it's an enterprise grade, compliant, and scalability.
Okay, well, that looks to be all the questions that we have for today. I'd like to thank everyone again for joining us. We appreciate the opportunity to walk you through how solutions like Dragon Copilot can help reduce administrative burden and support more efficient clinical workflows. If you would like to continue the conversation, explore a personalized demo, or discuss how this can fit into your environment, we would really love to connect. Our contact information is on the screen. You can reach us at 877 493 7497 or email us at info@zephyr-tech.com. Thanks again for your time, and we look forward to speaking with you soon.